What I'm really looking forward to is just having one single source of truth, single source of information, single source of being able to order tests, interpret tests.
When you speak to anybody who's gone to an electronic system, they'll never go back to paper. Not having to ever repeat your documentation.
So I'm very excited to be able to provide care that's more cohesive for our patients, and I think this will significantly improve our workflow efficiency.
I think bringing in a modern information system will provide everyone with some confidence. The confidence that everything they need is in one place. The confidence that they can communicate with others who are looking after the patient in a team.
I think it'll enable patients to have better access to their personal records. I think it'll also lead to secure digital communications between the hospital and the patient.
It is a great opportunity for us to be able to look at our current workflows, our policies, and our practices, and really create new workflows to bring us forward and be able to create harmonized workflows. It has some very intuitive tools that will really help providers in their everyday work. There are built-in advisories and suggestions that really will help clinicians as they're making decisions, planning care, and creating orders to really be able to provide the best possible care at the right time.
Having an integrated EMR like this is going to allow us to pull data from across our sites and from our partners across the community to make sure all the information we need is right there when we need it.
So going electronic in Project Odyssey is going to allow us to drive best practice and evidence to the bedside in a way that we've never been able to do before.
We will be moving to a completely electronic system with computerized physician order entry, which means all medications will be ordered in the system.
When I think about at least my patient population, many of our patients are seeing multiple physicians and subspecialists across the city. Now we will be able to communicate better and have everything all in one place for our patients.
Access to information will help patients better understand their condition and where they're going with it. And this will be done, I think, by having access to clinical notes, so they actually understand what the doctor is saying without having to scribble down notes themselves.
This is really important because it will help improve communication and patient experience at every encounter with the healthcare team. They not only will get access to their health information, their lab results, but also tons of educational references and resources.
You know, all of this will be available to me on my smartphone in my pocket or on my desktop at home. And for the patient, it's sort of moving from patchwork of personal records to secure access to a hospital portal. The need for technology has accelerated, and you know, even though things may go back to normal, all of us are used to doing things a very different way.
The evidence in the literature and in the world is obvious. Care gets better, our lives get better, patients' lives get better.
The timing is good now because things have changed around us, and we need to keep pace with that.
So Project Odyssey is getting us to the starting line, and we need your help getting to the starting line.
We have to fundamentally rethink the way we do all of the tasks. So we have to re-envision the future, re-envision the way we work, and so it's going to require all of us to have imagination and flexibility in rethinking how we change the way we provide care to our patients.
Really moving forward, this will be a clinical transformation of epic proportions, and really for us to be successful, it will be all of us working together and participating.